time, I think, ever, it scared me. During infertility treatments, as well as following and treating for endometriosis, like many, many women, I was continued on oral contraceptives, birth control, for treatment of the endometriosis in between the fertility treatments. Being a physician assistant, I knew very well what the risks were, but it was a risk I was willing to take the birth control, knowing that I didn't smoke and didn't have any other risk factors for blood clots, such as family history, history of strokes, no hypertension, things like that. Unfortunately, I suffered an injury to my left leg, my left foot, and had it immobilized for about 5 days and started developing calf pain. Don't know why, but I just had a feeling that something was wrong, and insisted on an ultrasound or a Doppler, and it showed 2 DVTs, which are deep vein thrombosis, in my left leg. The blood clot felt like I had broke my leg. I couldn't bear weight, an enormous amount of swelling. I noticed the veins in my foot were enlarged, very prominent where they hadn't been before. I literally could not step down on my foot. They were fabulous in this emergency department. They got me hooked up with Dr. Gomez immediately. He started me on Lovenox injections. I did those twice a day at home for about 14 days and started on Coumadin, which is relatively, simply spoken, a blood thinner. And then I remained on the Coumadin for 3 months, and last Friday was the end of my 3 months, and I am no longer on it. And the likelihood of it coming back, the blood clot, is about 5%. So from now until the end of time, I have to wear these lovely compression hose. When he first told me I had to wear them, he didn't give me the whole story. I think he didn't want to scare me. I had a lot coming at me all at once, and he said, you know, you're going to have to wear these for a while. And I thought, oh, well, great, you know, 3 to 6 months, maybe a year. And then last Friday he told me, you know, 5 years to life. And I thought he was joking. I think I even laughed at him, and he said, listen, you know, 5% is 5%. It's not 0. So if you're active and doing things, maybe you don't need them as much, but the minute you notice swelling, you've got to get them back on. I wish I had known the higher risk involved. They say about 25 women in 100,000 will have a DVT with birth control, which doesn't seem like a lot. So it's like one of those things where I don't really want to have the pain of of the endometriosis, so I'm just going to stay on it. And Dr. Gomez even told me a lot of his patients say, I don't care what the risk is, I want back on my birth control. A lot of people blow it off. A lot of patients I know have had, oh, this is my 3rd or 4th DVT, it's no big deal, they treat me, they put me on Coumadin. Well, it's a big deal to me. I don't want to be on medication, especially for something I could have prevented. In fact, ever since this happened, I've gotten together with some of the other PAs and nurses that I work with, and we're all really watching our diets. We're getting the salads for lunch. We're pushing each other. You know, the munchies are apples and things like that. And I think it'll make a difference in the long run. It's not a quick fix, but long term, it's definitely got to help.